Hey Shelby, how's it going?
Hey Doc, great to see you.
And I was thinking about something this week about my chiropractic history. When I first got into school, I was really focused on the physical body and doing the chiropractic work. And then I got into the nutrition and adding that to the practice. And after about 10 years in practice, I started realizing, man, how come some people, I do everything the same, and some people get better and some don't? And then I realized, I went to a course and I realized, man, there was one component we're missing, is that's the mind body connection, and what my patients are thinking and how that affects their physiology. So I really got into the last 20 years, really getting into how the mind body connection, and how, what your thoughts are and how you think affects your physiology, and how your body will give you signs and symptoms as feedback when you're having emotional imbalances. And so when I started adding that into the practice and doing the coaching work, that's when you get that extra 10 to 20% of people who just can't ever get better. And they got the cases that never seem to move. Once you clear out the emotions from their mind and balance their perceptions, man, the physiology starts to normalize and their symptoms go away and their feedback stops. So I just thought that was just thinking about that today, is how powerful it is to really work with the mind and how it affects the body.
Oh, I think it's brilliant. You've touched on a big topic that, is gaining a lot more popularity lately, and that is that mind-body connection. And there's been a lot of scientific research to show that, when you're having these emotions, intense emotions, resentment, frustration, pride, anger, guilt, shame, all of those, it actually has a chemical cascade in your body, and it releases neuropeptides from the brain and the body. And what I found so fascinating is that these neuropeptides, when they attach to the receptors, there's a large percentage of the receptor sites along the spine. And this, to me, it brought so many ahas for me, because I'd be working in the clinic and adjusting someone, and they would actually have an emotional response in the adjustment. I remember this one time, it was winter, and I was adjusting this woman's low back. And all of a sudden, after we had that beautiful release, she ended up just crying. And I was just like, what's going on here? Is everything okay? And she goes, yeah, I don't know why I did that. It just happened. And so what that and reading about this research began to really show me is that you can access the mind through the body, and you can access the body through the mind. And it's so powerful. They're so interconnected. You cannot separate the two.
Yeah, I've seen that in my own life. I've been super stressed out, feeling in my body, go get an adjustment and just tear up, because of something was released emotionally that was been stuck in my body for a while. And I saw that so many times over the years with patients. So I think it's just a valuable way to learn how to decipher your body's symptoms, and also decipher the meaning, because everyone reacts to stress differently, and whatever meaning you place on it, that's going to maybe be stored somewhere a little differently in your body. So you really got to get in and ask quality questions from people to really isolate what's the stress and what's the meaning and why is it stored here. And when you can identify those little issues, it's amazing how the body. That's when you see the miracles happen. From people where
Yeah.
they pour out the emotions and you get the miraculous healings. And I just have seen it so many times. You just don't want to overlook that piece of the puzzle when you're trying to get your body, your mind balanced. You got to look at your emotions and to get the physiology completely balanced. You can get to a certain point with the physical and the chemical, but you want to tie in that emotional to it. Now you can really get to that highest level of function, highest level of health that you can get to once you balance all three things out.
Yeah, so well said. So if you're watching this now and you're thinking, I wonder if these symptoms, this pain, this stiffness, these headaches might have an emotional component, let's start a conversation. Dr. Dave, where can people find you if they want to connect?
Go to the website, drdavetug.com. That's a little form you can fill out that you can answer a few questions, tell me what's going on, and that gives us a head start. Then we'll jump on a 20-minute call just to see if we think we're fit and find out what's going on. So that's probably the best thing to do. Yeah. How about you?
Awesome. Yeah, if you'd love to connect and inquire and see could what's going on physically be related to what I'm experiencing mentally? Feel free to set up a conversation. We can do that through LinkedIn, Facebook, Instagram. Any one of those platforms is a great way to connect.
Awesome. Well, this is an awesome combo. I love this topic. It's in my heart. Been doing it for 30 years almost. So I just think it's a very valuable thing for people to understand about the mind-body connection. So awesome talking to you.
So good talking to you, and can't wait for the next conversation.